everyone, I'm Dr. Jasmine Sung, and I am the membership chair for AAID. As we prepare for AAID's 75th anniversary annual conference, which is going to be held in Nashville from September 30th to October 3rd, we're highlighting some of our outstanding speakers. One of which today is Dr. Brandon Allison. I'm especially excited to introduce you to him because he and I first had the opportunity to meet last summer when we were both teaching at the AAID All-Star Life Surgery course, which was held at Dr. Michael Worley's place in Puebla, Mexico. So although Brandon has been practicing implant dentistry for many years, uh, he only just started joining the AAID 2 years ago, and he recently completed his Dallas Maxi course. This year, he's returning as a speaker and will be presenting future proofing implant restorations, everything from design concepts to challenging trends in home care as part of the team program. Brandon, welcome and thank you for joining us today.
Thanks for having me, Jasmine.
All right. Okay, so um, I've asked you this before, but I wanted to find out, what exactly brought you to the AAID in the first place? So you had already been placing implants.
Yeah, to be specific, it was my buddy Pat Breezy. I was at Danny Domain and Corey Glenn's course in Tennessee. And of course, there's some nerding out going on. And I wasn't really a part of the really any academy for implantology at that point. But Pat invited me, said that I would love it, and he was not lying. It's been a blast. I'm excited. This will be my third conference coming up. Excited to come.
Oh, awesome. All right. And what were, you know, what were your expectations when you went into the meeting and how were the last two meetings for you? I mean, as a newcomer.
Man, I think my expectation going into the first meeting, I didn't really know what I was getting into. I knew there was going to be some awesome educators, some early concepts, beginner concepts, all the way to advanced concepts and breakout sessions. So I was just excited to go learn, hang out with some friends. But really, what I didn't expect was just the massive group of people I brush shoulders with and become friends with now. That's kind of become my community for implants, and my engagement and excitement about implants just exploded afterwards. I think I could have kept going, putting along without being part of AAID, but I would not have been as excited or you know, as informed. I guess is the best way to say it. There's so many dogmas, but also concepts that change rapidly. And without being part of a community like AAID, it's impossible to keep up.
Yeah, I absolutely agree. I mean, every time I go to any implant meeting, I feel like just, talking at the coffee, like when we're grabbing coffee, I always learn a little something. And you're right, like we are alone in our practice, but when we are together, I mean, everyone's so open-minded
Mhm.
about improving and helping each other. I love the way how you had said that, though. So you had recently completed the Dallas Maxi course. Once again, why did you join this when I've seen your Instagram. You have some beautiful cases. So what made you feel like you needed to join this course in the first place?
I appreciate it, Jasmine. I think initially I was trying to get my accreditations and hours quickly and efficiently because we have a young family starting, and I know a lot of people can understand that struggle, trying to get a lot of my education done before we're into sports. We're not playing sports yet, but it's
Yeah.
coming, and I know the time is going to go away. It just life gets busier and busier. So I wanted to find a course or continuum I could rapidly get hours in without breaking the bank. I've done a lot of, just probably like you have, a lot of these courses, hands-on courses. You can get a lot of hours that way, but it's not the most cost effective. Um, and I plan on continuing to do immense CE going forward. But as far as getting hours, there was no better value than doing the Maxi course. And then the reason I chose the Dallas Maxi course, I kind of picked it right off the bat just because I really admire the educators. I knew the most about Mike Tran and Hardik, and I got to meet Aman. It was just and that's just three of the educators in that course. We had, such a great group of people. Even Ehab Musa coming down to the course. It was just,
Oh,
um,
yeah.
I got to learn things. I went in not knowing what to expect. My problem with a lot of the maxi course dogma is it's for beginners, and that's what I've always heard, but there were so many advanced concepts in every single module that I didn't expect, and I learned, I mean, I've probably learned more in those 9 modules than I have in the totality of the rest of my experience. So it was a great value, but really good time. I'm sad the course is over. I would love to just keep going back continually to hang out with those guys.
Yeah. Well, yeah, you can.
Yeah.
I'm sure you can. There, I mean, that's the thing. A lot of these people, they have these other these follow-up courses, and that's the cool thing about AAID is that you meet one person and they introduce you to another, and you just keep learning. It's just the journey never stops there.
Yes.
Yeah. Okay, so your presentation is titled Future Proofing Implant Restorations. That actually really caught my attention. What does future proofing mean to you, and why did you feel that this was a topic that you really wanted to lecture on?
I think I have always wanted a course like this. I would love to go to a course that was all about um, everything but the surgery. The actually placing the implant is a whole book by itself, but from planning to restorative to hygiene, combining concepts into a concise discussion or presentation, I hadn't found that yet. You can find a lot of people to discuss restorative concepts, and I know personally, Jonathan Esquivel, he's one of my mentors. He came up with Gomez Meta and Marcus Blatt's the aesthetic biologic concepts, the EBC zones. And I
Mhm.
think they just released today their EBC 2.0. So, it's just constantly evolving. Um, but stuff like that from zero bone loss concepts, how do we plan our restoration? I mean, our implant placement based on the type of implant we're using, the bone quality available, the biotype, gingival phenotype,
Mhm.
and then past that, what materials do we use to restore the implants? What type of contours and how are those contours dictated? And then past that, how can we help the rest of the dental teams and hygienists learn how to best maintain these implants and what matters on that front? So it's just a lot. It's probably going to be 3 hours crammed into 1 hour, but it's a lot of stuff that I've been really energized about and learning about rapidly that I would love to, just vomit all that information on everybody really fast.
So your presentation is part of the team program. Why is it important for the dental team to actually understand this kind of stuff?
Man, I mean, from the people answering the phones, understanding the gravity of the decisions the patient makes, even from
Mhm.
choosing who places the implant, to the timeline, to post-op instructions,
Yeah.
and then you go down to the assistant and hygienist level. Even their friends and family asking them questions about how they should keep things clean. Is what they're experiencing normal? What should the tissue look like? How much do things cost? I think if we're trying to get our patients to understand and do their part, everyone has to be informed. Otherwise, things get bottlenecked and patients don't get communicated. So I've
Yeah.
learned that the hard way.
Yeah, it is, yes, absolutely. And it's extremely important that the whole team is educated on the same thing. So there's
Mhm.
no miscommunication. Absolutely. Your title also mentions changing trends in home care. So, what are some of the biggest changes without giving away your whole presentation here?
Yeah,
Yeah.
that part of the presentation is not the longest, but I think it's something that is really relevant when we talk about, things like all on four surgeries and what are some contraindications. Even just going, I just took my written exam, and one of my frustrations with these exams is everything is from information from years prior. And
Mhm.
there's so much about best ways to keep implant prosthetics clean. Um, even from, proximal brushes. How should the hygienics of this prosthesis look for
Mhm.
patients to best keep them clean? What type of cleaning methods, water flossers or threaded floss down to toothbrushes. Now we have air polishers that I feel like everyone talks about, but no one actually knows how to use them. Techniques to use the air polisher, which materials or abrasives should I use in the air polishers, and I think there's just a lot of information that is either gate kept to different CEs or even prosthetics, the prosthetic side, lab techs gatekeep a lot of stuff. So there's things that people need to know how to communicate to their lab, to the patient, to the hygienist. So I'm gonna try to cover a lot, but get back to your question, just the changing trims in home care, what the patients can do at home. A lot of it has to do with water flossing and types of water flossing,
Mhm.
but access to care to patients with Parkinson's and Down syndrome, how do those people keep their prosthetics clean if you're expecting, them to have a certain level of dexterity with the water flosser? How can we help those patients to keep their stuff clean and make that an option for treatment for them?
Yeah. Okay. If someone attends your lecture, what's one thing that they'll be able to bring back to their practice the following Monday?
Man, probably just a system, even if it's a system for a lab script or a system to communicate patients to patients home care with their implant, or just a system to communicate to hygiene. I want to make it easy. Um, if you don't have a system, it's hard to implement. Implementation is very hard to do, and if you're not implementing quickly and rapidly with a good system, it's impossible. It's impossible to do well.
As someone who has only attended two meetings so far, what kind of advice would you give to a newcomer who has never attended their first meeting? I mean, what would you say to someone who's considering going to their first annual conference?
Man, I would say don't plan on rushing through this conference and sprinting out. Um, if you are truly going to this conference to learn and implement new topics and ideas, take off the Monday following or the day you get back from work because you're going to have a lot of information to digest. You're going to be tired. These conferences are awesome. There's so much information and interactions, but if you really want to take it serious and improve your practice, take the day off when you get back and spend that day figuring out your implementation.
I love that. I need to actually do that myself.
Me
Okay.
too.
Yeah. It's hard not to go back to work.
It is.
Um, okay. AAID is celebrating its 75th anniversary this year. So what does that milestone mean to you?
Man, so I don't know if it's true or not, but I heard that AID used to stand for American Academy of Implant Dentures. And
Yes.
just the concept of AAID in general, how much the academy's changed, how much implants have changed, and we're still going strong with the energy to learn and raise the field of implant dentistry. It just kind of um, it excites me. I think if we're still learning and implementing and changing, and this has been an academy for 75 years, and there's still so much excitement and growth, man, I'm excited for going forward, how much more and how much implant dentistry is going to change in the next 10, 20 years. It just makes me excited to learn. I don't ever want to stop learning.
Oh, all right. And what are you most looking forward to in Nashville?
Well, other than spending time with friends, I think uh, anytime I go to these conferences, I'm not really thinking about the environment. I'm trying to just focus on the uh, being at the conference. But Nashville is always exciting. Nashville has an underrated food scene, so I'm excited to eat some really good food, meet up
Oh,
with some good friends in Nashville, and of course see live music. That's a given. But yeah, just Nashville as a whole. I mean, it's gonna this is gonna be at the Gaylord Opry. It's a beautiful venue. I think just trying to commit to being there mentally and not trying to rush back to work.
all right. Okay, Brandon, thank you so much for joining us today. We're excited to have you as part of our speaker lineup. at the AAID 75th Anniversary Annual Conference. And we look forward to your presentation on Saturday, October 3rd. Thank you.
Thanks, Jasmine.